Dear organizers and the delegates of the 15th World Conference of Dentistry at Bangkok, to be held on 27th and 28th November 2025. Greetings to you all from Silicon City, earlier which was also called the Garden City of India, Bangalore. At the outset, let me thank the organizers for accepting my scientific lecture on endodontic periodontal interrelationship. This is my fourth occasion where I am talking to you in the World Conference after Kuala Lumpur, Malaysia, Barcelona, and Ho Chi Minh City in Vietnam. I had a brilliant academic career, having done my BDS at Government Dental College, Nagpur in 1972 as a first batch student. Later on, I did my Master of Dental Surgery in Periodontology in Government Dental College, Bangalore in 1976. Eventually, I was working at the University of Manipal, where I was the Vice Principal for the College of Dental Surgery, Manipal, and thence I was sent to United Kingdom as a Cornell Scholar to conduct myself as a postgraduate student in the Department of Oral Pathology at the London Hospital Medical College, London, and was awarded the Master of Science in Oral Pathology in 1985 by the University of London by Professor Neville Johnson and Professor D.W. Williams, and was offered to continue my research scholarship for PhD in Porphyromonas. Incidentally, I was also the president of the Indian Association of Oral and Maxillofacial Pathologists, Indian Society of Periodontology, Indian Association of Dental Research, as well as the Vice President of the Head Office of the Indian Dental Association. I was also an author for the three books, which are namely the comprehensive textbook of periodontology, the textbook of community dentistry, and also a chapter in the general pathology for dental hygienists. Well, today's topic, which I'm going to talk to you, is the endodontic periodontal relationship. Now, this endodontic periodontal relationship highlights the interplay between the pulp and the surrounding tissues of the tooth, emphasizing the need for a comprehensive approach to the diagnosis and treatment when dealing with these interconnected diseases. The relationship refers to the interconnection between the dental pulp and the endodontic aspect and the surrounding tissues of tooth, namely the periodontium. The disease of one area can affect the other, leading to the complex clinical presentation and diagnostic challenges. Well, the pulp and periodontium are interconnected by different ways, by way of accessory canals, lateral canals, and allowing the spread of infection and inflammation, and also through the apex of the dental tooth. There is a relationship so far, as I was explaining. The periodontal disease can cause pulpal inflammation and vice versa. For example, a severe periodontal disease can affect the pulpal infection via accessory canals. Thus, the endo and periodontal tissues coexist in the same tooth, and this infection can lead to endoperior lesions or endoperiodontal quandary. These lesions can present similar symptoms and making the difficult diagnosis. Distinguishing between the primary endodontic, primary periodontal, and combined lesions require careful diagnosis and radiologic assessment. The treatment approaches vary depending upon the nature and the extent of periodontal and endodontic involvement. The endodontic treatment is often the initial focus, followed by periodontal therapy. Subsequently, we can associate our periodontal treatment by way of doing either a flap surgery or by using grafts, by using membranes, or also by use of different root hemisectioning or by root amputation procedures. Well, finally, what I would like to focus in my talk will be to correctly identify the primary source of problem and crucial for the effective treatment planning and achieve a favorable outcome. So this would be my background of the talk. Thank you.